Good morning, everyone. We're going to go ahead and get started with the webinar. Thank you all for joining us. We want to welcome you all, and I know that you all are very busy, and we want to say thank you, and we appreciate your time to, to call in for this webinar about the site registration process for the state loan payment program. So I am going to have our IT staff introduce himself.
Hello everyone, this is Avinash. I work for the application development of PCO.
This is Vanessa Davis with the Department of Health Services.
And my name is Anna Rossetti. I'm the section manager for workforce here at the Arizona Department of Health Services, Bureau of Women's and Children's Health. So I'd like to provide you just a general overview of the site registration, who can register. So all entities that are considered public or private nonprofit entity or rural private practice sites can register in the portal. You have to meet the state loan payment program site eligibility requirements, and those are: one, you have to be located in a HIPSA. If you're not in a HIPSA and you happen to be a rural private practice site, you can still qualify if you meet the Arizona Medically Underserved Area designation, and we can cover that later on in the presentation. You have to accept Medicare access and the qualifying health plan in your area, and you have to be implementing the sliding fee scale, of course, except for free clinics and state prisons. So those of you who have attended a webinar last year, these are the same exact presentation that we did last year, but we have some new people joining in today. So hopefully you can kind of learn some of these, information for you to be able to successfully register. So some of the ground rules to register service sites, you have to, an employer can assign anyone to be a site administrator. And site administrators can create a profile in the portal. Once the site administrator creates a profile, then you will receive an email notice to verify your email account. And then in that email account, you will then be provided a link to go back to, or to be able to log in back to the portal. The site administrator can register one or more sites, and each site registration must indicate the service category. So if you're an entity with multiple satellite clinics, for example, if you have 10 satellite clinics and all those sites meet the SLRP service site eligibility requirements, you can essentially register all of those sites. So each site registration, you have to indicate what type of service category you're providing. So if a site has medical, dental, or behavioral health, you have to check all those three categories. And the reason being is that if you have a dental provider or a dentist working at that facility, but your site registration only indicated medical or behavioral health, then that person or that provider will not be able to apply online. A site administrator can register a site for all of these three categories, as I mentioned. So it is important because we have had issues in the past where, providers, reporting that they can't see their site online, and the reason why is because the portal is designed to kind of link in specific providers to specific, site type. So if they're a dental provider and the site is not registered for that category, then, that provider will not be able to go through with that application process. And then changes to the site information can only be done during an open site registration cycle. So when you start your registration, you can save your information at any time in the portal, and then you can come back. But once you hit the submit and you successfully submit your application or registration, you cannot go back and make any changes. What are your responsibilities as a site administrator? You have to, of course, make sure that you're gathering, entering and uploading the documents that are required for the site registration process in order for you to successfully complete the application. You have to verify provider employment and additional provider eligibility. You will be the point of contact for the applicant at the site, so we will refer applicants to you for questions about their employment verification. You will be the key contact person for ADHS for any specific questions related to the application. You will also be the contact person for any questions related to the provider applicant, or if you already have participants working at your facility, then we will contact you for those participants as well. You will be required to upload and provide additional documentation to ADHS per our request, and also update the site registration portal, or I'm sorry, the site registration each calendar year. So what happens at the beginning of each year is we deactivate all of the sites, and then you have to, if you registered before, you have to reactivate your site. But if you're a new site, then of course it's a new registration. But the important thing to note is that if you do not re-register your site will not be active in the system. And how that works is your providers, once they go in and log in and try to apply, they will not be able to see your site. So make sure that you re-register your sites each calendar year. And for those of you who are re-registering your sites, the nice thing about the portal is that you do not have to re-enter all the information that you originally entered when you initially register those sites. It's just a matter of you checking whether or not the information is still updated, and then uploading required documentation such as the sliding fee scale and other required documents to complete the process. So these are the documents that you have to prepare for your site registration or re-registration. So again, every year you need to give us an updated sliding fee scale table based on current federal poverty level guidelines, your sliding fee scale policy, your sliding fee scale signage, which is the posting that you post in your premises to inform the public of the availability of sliding fee scale at your clinic, and evidence of the site's HIPSA. So if you're registering your site, or you've registered your site as a medical site, then a primary care HIPSA has to be uploaded. If it's a dental, then a dental HIPSA, and then if you're a mental health site, then the mental HIPSA. And if you are registering that site for all three categories, then obviously you'll have to provide all those HIPSAs. The encounters data table, as a new site registering in the portal, you are required to provide 2 years worth of data. So it's last 2 calendar years, and the encounters data will basically capture your payer mix and the percent of underserved that you serve in the facility. And this is what it looks like. And this is actually used for when we score our applicants, to make sure that when you're entering information on here, that you're actually entering the most accurate information, because the percent of underserved is one of the factors that we look at when we're scoring our applications for, to be able to determine who will be receiving the award for that year. So make sure that, you're taking this data table as seriously as possible, because it can impact the outcome of the application. What happens after site registration? Providers then can submit their application online. Again, if your site successfully registers in the portal, then they will be able to see your site in the drop-down menu. You have to watch out for an email notification, because as a site administrator, every time a provider chooses your site as their site for the state loan repayment program, you will get notified saying that there is a provider who is requesting for you to verify employment with. So you have to address those emails, and I will explain what that means later on when we do the live demo. But there's also additional eligibility verification that needs to happen that the site administrator has to complete. You also have to print and upload a certification of compliance to the state loan repayment program as a site, and also the document has to be notarized. And that full document will have to be uploaded in the system. If it's missing and we start the application review process and that piece is missing, we will come back to you and say, hey, you need to get this done. So it does delay the process. And last year, we actually had a lot of our applications with missing, notarized certification of compliance and what we call the ESSI, or Employer Service Site documentation. So the applicants may contact you to follow up about their application. And again, we refer applicants to the site administrator for any questions related to the employment verification. So don't be surprised that your providers are actually contacting you for that. And we will provide them. Some of our applicants do not necessarily know who to contact, so we will provide your information to them. And we, of course, will contact you directly for any additional questions or documents that we will need for the purpose of reviewing the application, the SLRP application. So here's our contact information, and then we will go ahead and do a live demo of the portal. Okay, so there is on our website, there is a link to register the sites, and all you need to do is click on that link and it will bring you to this homepage. And for those of you who are basically accessing the portal to re-register their sites, all you need to do is to enter the email address that you've already created in the past and the password, and then log in. But for those of you who are new to the portal, if you do not have a sign-in or an account in the portal, you have to click No Account, Create One. It's taking a long time, sorry. Okay, so once you click on No Account, Create One, you will see the 3 different icons. One is a provider icon, one is attorney's authorized representative, and the site administrator. So the reason being is that this portal is being used by not just by providers. So this portal is actually for state loan repayment program and J-1 visa waiver program. So any provider applying for the state loan repayment program or J-1 visa waiver program will access the provider portal, so they will click on the provider portal. Many of our J-1 providers have authorized representatives or attorneys, and if they are such, then they will click obviously the second icon. And then for you all accessing the portal, because you're a site administrator for a state loan repayment program or J-1, you then will click site admin. So when you click site admin, this is as a new person registering in the portal, this is the information that you will be asked to provide. Your employer name, so it's a drop-down menu, and you can simply choose the name of the employer that you work with, and then your first name, your last name, your phone number, and then you will have to enter the email address. That will be your username that you will use in accessing the portal, and then you have to create your password and confirm password. Once you've done that, you have to click register, which I'm not going to do, but once you click register, then it will generate an email to your account that you just provided, basically this email that you provided, and you will have to retrieve that information to verify your account. And and in that email link, the email notice, it will provide a link directly to log back into the portal. Once you retrieve that email, then you will be brought back to the sign-in page, and that's when you will have to enter the email address that you just provided, and then your password. So for the purpose of this demo, I'll go ahead and use this dummy account that we've already created for the demo. And I'm going to log in. And then you'll see this page where it shows 6 different bubbles. One is employer information. So employer information will collect information about your employer. Active sites information, this is where you will see all of the sites that are active in the system. So if let's say you've already registered your site successfully in the system, then it will show the number of sites that you've registered. Right now, it's showing there are 2 active sites in the system. Pending approval is basically the number that appears here is the number of employment verification requests from providers. So if there's any number on here, you must address those requests. And then incomplete application. So after you've actually accepted the request or the verification on step 3, I'm gonna show you in a minute, but I'm just explaining to you how this works. Incomplete application is basic. So let's just say there are 2 pending approvals here, and you've accepted those verifications. You've approved them. It will show on incomplete applications, and the reason why is because there's additional eligibility questionnaire that you need to fill out. Unless you complete this step 3 and step 4 process, you're not done. So make sure that the numbers appearing on under step 3 and step 4 is 0, because otherwise that means you haven't fully completed the employment verification process. Now, if the number turns 0 on step 3 and step 4, then you know all of those requests have been processed by you. It will appear on step 5, which is complete application. And right now there's 7 completed applications because it actually shows you also all previous applications that you verified. And then we're not going to talk about the encounter information because this is only for providers who have already been approved for the program and they are required to submit their encounter information. So this is how that works. So in order for you to navigate through the system, you have to start with step 1, and you'll start with employer name. Employer name will already be pre-populated because you provided your employer name when you created the account. So this one, we chose AZBHS as the employer name for this dummy account. So it's already pre-populated. Now it's your responsibility to put in all the additional information that's being asked here. So you can see the manager's name, the CEO, or sometimes it's the practice manager's name. So it's the CEO's designee can be on here. Your mailing address, city, state, zip code, email, and whether or not you're a for-profit or nonprofit, and then whether you're public or private. Once you've done that, you click submit, and it gives you a prompt that says your employer information has successfully been submitted. So it will bring you to this screen, and this is step 2. Actually, at any time, you know, when you're in the portal, anytime you want to go back to the landing page, click on the ADHS icon on the upper left-hand corner of your screen, and it will bring you back to this landing page. So we were at step 2. I'll go back, click on that, and you will see there are 2 tabs. One is State Loan Repayment Program sites and J1 sites, because like I mentioned, this portal is used by not just by SLRP, but also J1. So if you're registering your site as a SLRP site, you will have to click on the SLRP site tab. And you can see right now there are 2 active sites in the system, Site Demo 2 and Site Demo, and the address, the email of the contact person at the site, phone number, and the status is active, and these were created last year. So if you want to add a site, so if you're one of those entities where you're registering multiple sites, you can keep adding your site, click Add New Site, and it will bring you to the screen. And for those of you who have used our paper application before, it's exactly the paper form, except that you're putting the information electronically. So you're providing the information electronically. So you're going to provide the service site name, the phone number, the email, and then the site address, city, state. I mean, it's pretty self-explanatory. And then your practice type is a drop-down menu, and you can choose what type of practice site you are. So a rural health clinic, critical access hospital, FQHCs, and then you can click other. And if you're an other practice type, then you'll have to identify your practice type. And then it asks you for, these are service site eligibility questions that you'll need to respond to. It's a yes and no answer, whether or not you accept Medicare, whether or not you accept Medicaid, a qualifying health plan, and implement a sliding fee scale. So the answer to, even though there's a yes and no answer to these questions, you have to click, you have to obviously, to qualify for the program, these are required. So so our hope is you're actually accepting all of these insurances. If you click on yes on the qualifying health plan, provide a health plan name and health plan number, and you can keep adding on. Let's say you have 3 different qualifying health plans that you accept. You keep on adding the health plan until you're done, or you can delete it if you don't want to provide anything. So if you click no on any of this, it will flag you. For example, Medicare, is this a dental or pediatric site? If I say no, this is a requirement, because Medicare is not necessarily, so pediatric clinics, for example, they don't necessarily have Medicare assignments, so those could be an exemption. But in general, this is a required requirement for SLRP sites. And then let's say you click no on Medicaid, it will again tell you this is a requirement. So hopefully you're not just clicking yes just to navigate through the system, that you're being truthful with your responses and that you actually accept all of these government insurances. And then sliding fee scale, yes, this is a requirement. The only time, so it says there's a note here that if you're a free clinic or state or federal prison, those are the only entities that are exempt from the sliding fee scale clinic. Otherwise, you'll have to, of course, click yes here and then attach the appropriate sliding fee scale documentation with your application. And then distance from the next nearest sliding fee scale. There are a lot of help links throughout the portal that you can click to, and where you don't necessarily have to leave the portal. Everything is provided for you. Hopefully, like for the sliding fee scale clinic, all you need to do is click on the field, sorry, and then enter your, let's say, 85007, which is our zip code here, and it will give you a list of all the sliding fee scale clinics that's located in your area, and you will have to then enter the next nearest sliding fee scale clinic of similar type services. And you can see here they're color coded and the legends are here. Mental health is red, primary care. So if you're a mental health site, you'll have to provide the next nearest sliding fee scale clinic that offers similar type services. So the next nearest mental health clinic from your zip code or from your site. And then this is what I was talking about earlier. You have to check the categories that apply to your site. So whatever type of service that you're offering at your facility, you must check. So if you're a medical facility only, check medical, then it will ask you to provide your HPSA ID and HPSA name, which if you access this HPSA Find link here, that's where you will find that information. And so you get to this homepage, and I don't know why, because they recently changed the format of the federal website. So you're going to have to navigate to shortage areas by address here under tools. And then this is where you're going to enter your address. So let's just say I'm going to enter our address here. And zip code is not really needed. Once you search, okay, so this address is located in a primary care HPSA because I checked that my clinic offers medical services. So this is what I'm going to select. All you need to do is print this page, and this is the one that you're going to upload later. Then going back here, if you click all three categories, then same thing, you're going to provide the behavioral health HPSA ID, behavioral health HPSA name, and then data table specific to that category. So here is the behavioral health data. We click on dental category, provide a dental HPSA name, dental HPSA table, and then medical. So on this, on this shortage area, just for those of you who are not familiar with the HPSA report, it tells you the number is here. So if you're choosing dental, this is the number, and then the name of the HPSA is the Low Income Central City Village HPSA. That's how you're going to, that's the info that you're going to use when you're filling out the form. So for those of you who are re-registering your site, like I mentioned earlier, so you're a returning site and you're just reactivating your site, you're not required to enter 2 years worth of data. So what's going to happen is when you when you get to this page, it will show that one of 2018 numbers are already pre-populated, and then all you need to enter is 2019. And then when you're entering information here, it does the automatic calculation for you, and that's the percent that we're going to use when we're scoring applicants. They actually receive an extra 4 points for depending on the percent of underserved that they're serving or your site serving. Now, there are some sites here who have not been operational for 2 years, and there's no data available for 2 years. If that's the case, all you need to do is enter what's available. So let's say you have available data in 2018. Let's say you started in June of 2018. Whatever data from June to the end of the year, you can enter. And then enter your notes here as to why you can't provide 2 years worth of data. And then again, if your site is not an AHIPSA and you are a rural private practice site, then you can still qualify if your site is in an ASMUA or Arizona Medically Underserved Area. This is a state designation, so it gives you like the step-by-step on how to get to the report. But basically, the report this is what it looks like, and the report will give you a list of all the areas ASMUA name, and those are the areas that are currently designated as state medically underserved area. So if your site is a rural private practice site in Benson, for example, then that site could still qualify for the program. Now, save and continue. Okay, so because there's no data, we'll just say clinic opened in December 2018. Okay, save and continue. Okay, all right, so it's not letting me go through it. Hold on. So actually, I'm going to go back to the demo. So there are 2 active sites in the system, so we'll just use those sites, and then I'm going to switch my slide to the provider. That way you know what it looks like when a provider actually requests an employment verification from you. Actually here. Okay, so this is the provider portal, and this is a dummy account that we've already created for this particular provider. So the provider already started the application. Applicant name is SLRP demo, and some information about this provider. Provider is a new applicant to the program and submitting application for the year 2019. All that the provider needs to do is resume an application and basically navigate through this tab that you see on the top of your screen. So, so what's going to happen is that when the provider gets to the employer service site tab, this is what it looks like. They're going to then, or the provider will then select the employer name, which is AZDHS, and the site administrator, which is, I believe it's, what's the site administrator? Demo 1, Abby? Okay, sorry. So this is the dummy site admin account that we have. So the provider will be able to see your name in the drop down list, and then once the provider selects the demo account site admin, then there are 2 sites that are registered in the portal. So if you're the site administrator for 5 sites and you've registered all of your 5 sites, it will show on this drop-down menu. So for the purpose of this demo, I will click Site Demo, and I'm going to Add Site. So once the provider added that site, then it will show on the bottom of the screen, and it says the assigned service site is the employer name, the site administrator is this one, site admin, site name is Site Demo, and then the employment verification is pending, and the site admin validation is still incomplete. Now, I'm going to now switch back to the site admin, so you can see what it looks like on your end. So now there's a pending approval here, 1. So anytime you see a number here, you will have to address that. Step 3, click on step 3. Here is what the provider just sent you a request to verify employment, and it says provider employment verification request, pending site admin approval. You have to click the box opposite that provider's name. If, of course, you have to verify that that provider obviously is working or will be working at that site. And then you hit approve. Are you sure you want to approve this request? Yes, approve. Request has been approved and the provider has been notified. So every step of the way, the provider will get notification in terms of the status of their request. So your accepted request will appear on this bottom here. You see 487. This is the one that you just accepted. So it will show you all the history of employment verifications that you've done over, I guess, over the course of your time as a site administrator for that site. So once you've done that, you can then go back to the landing page, and now that you still have an incomplete application here, and again, this needs to be 0. Step 4, this is the additional provider eligibility verification that you'll need to complete. And it says the status is incomplete. Click on the provider name, and here you're going to provide the start date of service, the expected number of service hours at the site, and whether or not the site is full-time or half-time. So let's just say you have a provider who's splitting time between 2 sites. The provider's employment status, it does say at this site, but if the provider is applying as a full-time practitioner, click full-time. If the provider is applying as a half-time practitioner, then you have to click half-time. But on here, if the provider is say working at this site for 20 hours in another site for another 20 hours, indicate that on the expected number of primary care service hours at that site. So why is this important? Because whatever you enter on this field for us, it determines the provider's primary site. And by policy, we will score the provider's primary site. So if a provider has been or will spend at least 20 hours a week or more at that site, then that is a primary site. So our process when reviewing the application and scoring the application vary depending on whether the site is splitting time equally between 2 sites versus provider serving primarily one site over the other, or the split of hours is heavy on one versus the other. So make sure that you're accurately reflecting the number of primary care service hours at that site. So telemedicine, this is important because if you're a provider, especially in the rural areas who have providers who provide telemedicine services, you need to indicate the number of hours of the full-time hours. And then by policy, the distant site and the originating site. So the originating site is where the provider is, and then the distant site is where the patient is located. So if a patient is coming to a satellite clinic and you're in another, or the provider is another place, then you're going to reflect where that satellite clinic is, that the provider will be seeing patients. And by policy, both of those sites, the originating and distant site, they have to be both in a HPSA. Otherwise, it's not going to qualify. Now, we have providers that are working in critical access hospitals. Critical access hospitals, the services that are rendered in a hospital, in general, hospitals are not eligible for the program, but all except for critical access hospitals. So if a provider works in a rural health clinic in conjunction with a critical access hospital, that's the only time that it will qualify for the program. So if you're one of those facilities that you're a rural health clinic / critical access hospital, you need to provide the information for the CAH on this field, and then the number of service hours that the provider will be serving at that facility. And we have a requirement here that you have to read because there's a maximum number of hours that the provider has to spend at a critical access hospital. And then once you've done that, you click submit. Okay, so I'm just gonna enter that the provider will start working January 1, 2020, and it's a 40-hour per week at that site, full-time. And then I'll hit submit. So this is the certification page that I talked to you about. Last year, we had a lot of employers with either they didn't submit the notarized form, they checked all of these boxes and they certify that they comply with the requirements. And basically, this is just if you go through this list, which I'm not going to go through for the purpose of time, but basically you're certifying that you meet all of the requirements of our program. And then there's a certification that the information that you presented is correct or accurate. You initial on that field, and then the consent to release information, initial on that field. So for the purpose of this demo, I'll go ahead and check all of these. And then hit save. And so this is the important part. So I mentioned earlier employer and service side information. So we cannot do away with the notarized form. So the notarized form is important. So what you're going to do is you're almost you're towards the end of the the verification process. This is the most important thing that you'll have to do for the verification process. It's to download a form. So click download. It will appear on the left-hand side at the bottom of your screen. And then here's the form that some of you may be familiar with this form. This is the exact same form that we used when we were operating in a paper-based system. But except for this time, it's pre-populated with the information that you've already entered electronically. So if you scroll down, it captures everything that you've entered, the data that you've entered. Anything else that you entered will be pre-populated on this form. Now, the last page, as you can see, is a page for your signature and for a notary. So you're going to then print the form and sign it, notarize it, scan it back, upload it in the system as a PDF. So how you're going to do that is, let's just say you downloaded a form, you printed it, you signed it, notarized it. Now you have a PDF form that you're ready to upload. You have to then click choose file. This is the one that we just uploaded, the employer service site information form. I've chosen the file, upload. And it shows that you've uploaded this PDF form, ESSI, and you can see the name of the provider and then the site name. And once you're done, so make sure you see this, that you've successfully uploaded your document. You click submit. It says the provider verification has been submitted successfully. You will now be redirected to the home page. So that means you're done with the employment verification process. So if your site, let's say you have 10 providers that are applying to the state loan payment program at your site, you will do the process, the employment verification process for each of those providers, and make sure that you complete this section where you'll download the information or the documentation and then upload it back in the system. So now you're redirected to the landing page. You have 8 complete applications. So you click on that just to make sure this is the one that you just processed, this SLRP demo. Now it's there. So now you know that you've completed the verification process successfully. So that's it. That's how you're going to verify the provider's information. So there is something that I wanted to add for the active sites here. I'm going to click on here, the site demo 2, because I neglected to show you the page where you're going to, I don't think it's going to let me though. Okay, so, sorry, go back. So I'm going to click, I'm going to add a dummy account here. I'll say site 1. So bear with me. I just want to show you how to get to the upload page for the supporting documentation. And then okay, so every time there's a missing, a missing field, it will flag you. All right, so now, hopefully we'll go through this. Did you see anything else? Oh, medical HIPAA ID, okay. So at the top, it's telling you that the ID name for medical and the name in the ID is missing. So I'll go ahead and enter that information here. Okay, I think it should work. All right, so this is the upload section, and for those of you who are re-registering or registering your site for the first time, this is where you're going to upload the documents that are being required, and you can see they are labeled by heading. So the first document, these are all the documents that we check, and the reason is it's part of the application for the provider. So if you didn't provide any of this information, we will go back and say to the provider, your application is deficient. Please work with your administrator to submit this document. So the sliding fee scale, I'll just download. You can drag and drop, or you can click open, and it will upload it into that section that you either drop or trying to upload the document. So you'll see here that this file has been uploaded. And then there's a sample document here in terms of what exactly we're looking for, and it will show you, basically give you some sort of a idea of what it is. And sliding fee scale policy, in a nutshell, it's the policy or the process that you do to implement the sliding fee scale. So your policy at a minimum should include, for example, who's eligible for the program, how are you determining income, what sorts of documentation you're asking, how long is the sliding fee scale for, when do you reassess the patient for sliding fee scale eligibility, things of that nature. We'll go back here and do it again, upload the necessary document. I'll drag and drop. Now you can see that this document is there. And then there's a link. So sliding fee scale, this is just a sample. So don't think that this is an updated link. You cannot use this because this is obviously, it's not going to be the current federal poverty level guidelines, but this is what the table looks like. So for those of you who are not familiar with sliding fee scale, how you'll know that it is the current federal poverty level, it's based on current federal poverty level guidelines is this number, the 100% maximum income for 100% FPL should be based on the federal poverty level guidelines. So there is a link here for you to check whether or not what you're uploading is the current poverty level guidelines. When you click on that, it will bring you to this page, and here you can see this is the current guideline. So now you can see that, that your table has to, at least the 100% category should be based on this, and then should be recalculated accordingly based on the different income categories that you have on your table. So if it's not following this these levels that you see here, and of course the federal poverty level guidelines are updated yearly around late January, early February of each year. So every time you access the link in the portal, it should provide you the most updated poverty level. If you're not seeing these numbers on your table, that means it's an outdated sliding fee scale. So now we're going to click on the sample signage, again, drag and drop, and now it's there, and then evidence of a HIPAA, drag or drop. So if you do not upload anything in any of these boxes, it will flag you because these are required. So does that mean that you uploaded the correct document? You may not have uploaded the right document, but the portal expects that you upload something on here. But hopefully you're uploading the right documentation for every field. So this is the only time where the portal is not expecting for you to upload anything. However, if you have other documentation, so for example, we go back and say, okay, well, we need the proof of nonprofit assignment, then you can use this field to upload the document that we're asking for. So for right now, we've uploaded the required documentation. I can click save. So it says your files have been uploaded successfully. Your site registration is complete. You're now redirected to the home page. It says your files and 3. I don't know because we uploaded 4. So that might be just a glitch. So if you go back to the active site, there's now 3 sites. And here is the site that we just created. So that's how you're going to verify whether or not your sites have successfully been registered in our system. Let's say your providers ask you, is this site registered? All you need to do is go to the landing page, access step 3, and it will give you a list of all the sites that are active. If the status is inactive, you will still see it on this list, but the provider, when they apply, if it's on inactive status, they're not going to see that on their drop-down menu. So make sure the status of the site is active. So I'm going to, I think that's it. That's the end of the presentation. We are going to close the webinar. Well, first we're going to check to see if there are questions in the chat pod. And just so you know, the webinar is being recorded. We will provide the webinar recording, we will post it on the website as well as a copy of the slides. Also, there is a site reference guide that's available on the website. It's basically the same exact demo that I provided, except that we're providing you a print screen of every single page in the portal. So make sure that you review that, and then hopefully, if you have any questions at any time between now and when the site registration cycle opens in the beginning of the year. So the site registration will open beginning of the year, January, until end of February. And during that time, that is when you're going to either enter your new sites to register or reactivate your site. And then, which will be in time for the renewal process, which will occur March 1 to April 1. And then also for the new applicants, provider cycle that will open April 15th around the time till June 1st. Anyhow, we're not seeing any questions in the chat pod, so we're going to go ahead and end the webinar. We want to thank our team, which you see on the screen. Anytime you have questions, feel free to contact me or Ashley Nance. We work together, and you can feel free to email us or contact us by phone to get assistance. Thank you very much, everyone.